and welcome. You're watching Health and Wellness Save a Life. I'm Gargi Rawat. When medical emergencies like a cardiac arrest happen around a person, it's important to be prepared. You can help someone in a medical emergency only when you're clear as to what is to be done in such a situation. And if you're aware and informed, well, then you can take steps to revive a person and save his or her life. Worldwide, millions of people die of sudden cardiac arrest. This is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation, that's CPR. Many adults in cardiac arrest can be revived with intact neurologic functions if the bystanders provide immediate CPR. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Avinash Ashok Gutte, consultant interventional cardiologist, Ashirwad Heart Clinic, Panvel, Dr. Darpan Chaudhary, interventional cardiologist, United SSH and Trauma Center, Gondia, and Dr. Kabir K. Sethi, consultant interventional cardiologist, Delhi Heart and Lung Institute, Super Speciality Hospital here in Delhi. Thank you so much, doctors, for joining us on the program and talking about this important issue and explaining to people how they can save a life. Dr. Gutte, I'd like to start with you. What is the difference between a heart attack, a cardiac arrest, and heart failure?
So these basically are three cardiac emergencies and all need to be taken care of immediately. So coming to the first one, that is heart attack. Heart attack, basically it is stoppage of blood flow to the heart, that is the coronary arteries, they get blocked with a blood clot and heart itself doesn't receive oxygen. Now any muscle in body as well as heart muscle, it requires oxygen for its normal functioning. So when it doesn't get oxygen, it starts dying and its function gets affected. So when the blood clot or a plaque that is built up in the arteries, it gets accumulated and it obstructs the flow, patient has an heart attack. Chest pain or sweating, breathlessness or giddiness, dizziness and sudden loss of consciousness can be presenting symptoms. Now cardiac arrest is basically, it is an electrical disturbance. Patients who have cardiac arrest, they generally fall unconscious. First they may complain of dizziness and they fall suddenly unconscious. So this is an active emergency. Most of the heart attacks, they don't cause cardiac attack, but cardiac arrest, the major reason is heart attack. And heart failure, basically the acute heart failure is an cardiac emergency. It is basically due to pumping failure. The heart muscles, they get weak and because of which they don't pump properly so that the oxygen is not distributed properly. Many times heart attacks, valvular causes or congenital cardiomyopathies, acquired cardiomyopathies, they can be the cause of heart failures.
All right, so important to understand all these differences. Dr. Chaudhary, as we know, heart failure is when your heart is unable to pump blood which is sufficient to meet the body's needs. Can heart failure lead to sudden cardiac arrest?
Yeah. Definitely, heart failure can lead to cardiac arrest. As Avinash sir correctly said, heart failure leads to abnormal electrical malformation that leads to heart into rate goes very slow or rapid or irregular. Because of that, heart does not able to pump the blood and it abruptly disrupt the flow of heart to the lung and brain, and that leads to abrupt loss of function of this function and that leads to death. What are the different causes for heart failure? As sir says, it is heart attack. Heart attack leads to heart failure. Other causes, congenital heart disease like hole in the heart or valvular condition in which if there is valve are not properly opening or there is a leakage, that leads to heart failure and that leads to cardiac arrest. And there are some congenital condition in which there is a electrical abnormality like Brugada syndrome and long QT syndrome, that also leads to cardiac arrest. So electrical malformation mainly affect lower chamber of the heart, that we used to call it ventricle, and because of that there is abrupt loss of blood pumping from the heart. So definitely heart failure leads to cardiac arrest. Thank you.
All right. Now, Dr. Sethi, if we can come to, the causes that are leading to a lot of younger people developing heart issues. A competitive lifestyle keeps this generation under constant stress, and can constant stress cause sudden cardiac death?
Absolutely, most definitely. Stress can certainly lead to sudden cardiac death. In fact, amongst all the exogenous factors that are known to precipitate or trigger an acute event, and by exogenous factors, I mean strenuous physical exercise, exposure to air pollutants, smoke, emotional distress, excessive consumption of caffeine, alcohol, and so forth. Amongst all these exogenous factors, the most promising one or the most relevant one that seems to be or that can precipitate an event is emotional distress. In fact, what has been noted is that about 20 to 40% of the sudden cardiac deaths can be attributed to emotional outburst or an emotional distress alone. So how does an emotional distress lead to such a potential life-threatening condition? Now, whenever an individual gets exposed to an emotional outburst, there is something called as a sympathetic override. Now, what do I mean by sympathetic override? It simply means that the heart starts to pump or beat faster than the normal. And at times, it can go on to beat as high as 250 to 300 times a minute, which in turn can translate into a complete life-threatening arrhythmia, which in turn can lead to a circulatory failure, a cardiac standstill, and sudden cardiac death. So certainly, exposure to constant stress can absolutely enhance the risk of developing a life-threatening complication, such as a sudden cardiac death.
All right. Dr. Gutte, if not treated immediately, sudden cardiac arrest can lead to death. When sudden cardiac arrest does take place, how does CPR then help?
Yeah, first of all, CPR or the cardiopulmonary resuscitation. I think it is the most beautiful thing that one needs to understand. It is basically to revive a heart that has stopped and to help the pulmonary, that is the lung, to get into the oxygen so that it can deliver it to the body. So the main component is the cardiac component, and it is very, I would say, easy to learn it. So cardiopulmonary resuscitation can help the chances of survival of a patient who has fallen down. It increases the chances by 2 to 3 folds of that person surviving. So if you do CPR, if the patient has bystanders and there are people around him, and a basic understanding of CPR is there, and I think all these programs we are doing for that purpose. So the basic CPR, it goes that you have to first shake the patient, you have to ask whether he's fine. If he doesn't respond immediately, you have to do the chest compression with the hands on the lower part of his chest, and you have to compress it almost 120 times per minute. So you can divide it into 15 seconds. For every 15 seconds, you can give 30 compressions, and if possible, 2 artificial breaths. Either you can pinch the nose, give it with the mask if available, or the traditional has been mouth-to-mouth respiration. But I would say the cardiac component is the most important part, because if we compress 2 inches, or I would say around 5 to 6 centimeters the chest, the heart is immediately below. I would like to show a picture where we can see the heart, it is immediately below the your compression part, and it would start functioning, and brain or the vital organs, they would receive the oxygen. So the chances of, even if the partial circulation is taking place, the chances of revival are maintained. And the next part is of the CPR. If there is an automated external defibrillator, you have to apply the patches over the chest, you have to charge it, and you have to press the deliver button. So immediately the shock would deliver. Basically, you have to understand it's an electrical abnormality, the cardiac arrest, and if CPR is given on time, you are helping the patient and his survival, so that he reaches the hospital or ambulance or paramedics, they come and they try to help him in a medical way. I think all of us should teach CPR to those who are around, and I think this is the most important thing that we can do for our society.
Right, so important for everyone to learn CPR, as there's so many incidences of heart disease among people, especially families. Dr. Chaudhary, now according to our discussion, CPR is a life-saving technique. So will CPR always save a life?
CPR not always save your life, but it increases the chances of your survival by double or triple. And what are the statistics says 9 out of 10 cardiac arrest which occurs outside the hospital won't survive. Either they won't get CPR properly or any bystander won't give it. And out of these outside hospital cardiac arrest episode, 7 happens at home. And every heart patient relative should know how to give CPR. And I want to repeat it again. How to give cardiopulmonary resuscitation. You have to put your palm hand like this and give compression by keeping your hand on the lower third of the chest and give compression by 5 centimeter. And you have to give it 100 to 120 compression per minute with after every 30 compression you have to give 2 rescue breathing. So there is no need of any formal education for cardiopulmonary resuscitation learning. Just go through some YouTube videos, you can learn it properly because it's a life-saving drug, and if you start it as early as possible in first 2 or in first minute, then the chances of survival again increases. So everyone should know how to give CPR.
All right. And Dr. Sethi, does CPR apply in both conditions, like cardiac arrest and heart attack? In both conditions, does one use CPR?
Most definitely. CPR is absolutely valid for cardiac arrest as well as heart attack or myocardial infarction. In fact, both these clinical conditions are absolutely interrelated and one can lead to the other. Before we get on to this question, let us first understand these entities clearly. Now, what happens when an individual is experiencing a heart attack? Now, when an individual is suffering from a heart attack, the heart is primarily robbed of its vital blood supply, and that is all thanks to the occluded coronary arteries. However, in case of a sudden cardiac arrest, there happens to be a cardiac malfunction, which causes the abrupt or an absolute cardiac or a ventricular standstill. The heart stops beating all of a sudden. Now, definitely an ongoing heart attack can lead to a cardiac standstill and a circulatory failure. Now, when this happens, the person or the individual can collapse. Now, initiating CPR or chest compressions in this individual or such an individual can help you to restore blood. It may not be completely oxygenated blood, but it would still be somewhat oxygenated blood, and it can help you to restore this blood to the vital organs, the most vital organs such as the brain, the heart itself, the kidney, and so forth. And this can simply help you to keep the person alive until further aid arrives. Chest compressions in these individuals primarily mimic how the heart functions and helps you to keep the blood flowing through the most vital organs of the body. So yes, certainly CPR is extremely valid, irrespective whether you have a circulatory collapse leading to a standstill or the patient develops a circulatory failure or a respiratory failure.
All right, so that's about CPR. And Dr. Gutte, so when should one stop doing CPR on a person?
So the basic purpose of CPR is help the patient revive. So if the patient is coming to the consciousness, we are seeing signs of breathing, him getting conscious, and the medical help has arrived, then I think we should stop CPR. But on the contrary, even after 20 to 30 minutes, if patient is not able to be revived and there are no signs of pulsations, I think in a situation where the facilities are quite far, we need to reassess. If the facilities we are known, they are going to get us within stipulated time of 5 to 10 minutes, we have to continue till the medical help it arrives. See, most important thing to know, I think everyone in the medical field knows. See, there have been incidences 45 minutes, 1 hour, 1.5 hour of CPR, and we have saved patients. So there is no such stipulated time limit. You have to customize each and every patient's need. For an cardiac arrest occurring just in your surroundings, you can call for help, and within 10-15 minutes, 20 minutes, we expect an ambulance to reach over there, which has an defibrillator, or at least a paramedic who can advocate some proper drug, or you can give a shock to the patient. So till the help arrives, first thing, and second, and if the patient is getting conscious, in these two circumstances, I would tell to stop CPR.
All right, so important to keep that in mind. Well, we have more questions for the doctors, but for the moment, we'll slip into a short break and return with more. Stay with us. Welcome back to our special show, Health and Wellness, Save a Life, where we're talking about the importance of CPR and how knowledge of CPR can help you save a life. Let's return to our doctors now. And Dr. Chaudhary, we spoke earlier about, the importance of CPR and what situation to perform it. But can there be some sort of drawback, some damage? What happens if too much air gets into the stomach during CPR?
Yeah. First, for this gaseous distension, how it affects lung expansion, we have to first understand how lungs works. Lung below, this is a lung, and below that there is the layer which we used to call it diaphragm, which consists of muscle and fiber, and below that there is an abdomen. So this diaphragm function as a suspension. When we inspire, lung expand and this diaphragm goes down. So it creates a space to expand. Create a space for lungs to expand. So oxygen and air comes inside the lung. And when we exhale, it gets contracted and this diaphragm comes up. So when there is a gaseous distension inside the abdomen, that is stomach, so it prevents the diaphragm to goes down. So when we give rescue breathing with forcefully, air goes into the stomach and it leads to gaseous distension, and that prevents lungs to expand, and that hampers our oxygen. So how to prevent it? We can prevent it by head tilt and chin lift. By proper position, we can give rescue breathing effectively, and it will increases the survival chances of our cardiopulmonary resuscitation. So I am again repeating how to keep your airway patent by head tilt and chin lift. So with proper maneuver, we can effectively give cardiopulmonary resuscitation, and gaseous distension will definitely hampers our effect of cardiopulmonary resuscitation.
All right, Dr. Sethi, now we've been speaking about, how it's important to know about CPR, and if you could just emphasize how important is it for, caregivers, family members to learn CPR, especially those who have a family member who's suffering from a heart disease.
Yes, definitely. See, any individual who is living with a heart disease or an heart ailment, no matter how recent or how old the heart disease is, the risk of any potential life-threatening event is always looming. So therefore, the family members or the caregivers of such an individual should be trained to practice the simple technique of CPR or cardiopulmonary resuscitation if they happen to find themselves in an emergency situation like this. See, not necessarily giving chest compressions or rescue breaths will always save the individual's life, but it will certainly enhance the odds of patients surviving that event. And even if the patient does not survive that event in the long run, it will at least delay the tissue death. It will keep the tissue partially oxygenated and buy you time until further aid or further help arrives. So definitely the family members or the caregivers of such an individual should be able to practice this technique of chest compressions as well as the complete aspects of CPR so that they can help the individual when the need arises.
Right. Dr. Gute, if you could tell us, what is the recommended rest period for someone who has suffered a sudden cardiac arrest?
Yeah, first of all, we need to evaluate what is the cause of sudden cardiac arrest. Most of the times it is an heart attack. So if the heart attack is caused, we generally the patient stays indoor for 3 days to 5 days. Before discharge, generally the patient is evaluated to see how the function of heart has improved, or what is the function at the discharge. Depending on that, if the heart function is absolutely fine, I think a week's time, patient is it is a week's rest. It is sufficient for patient, to gain the total vital function of the heart, and he can move around and do his routine activities if they are light. If the heart function it is compromised and patient needs some more time, generally up to 3 to 4 weeks, we advise patient rest so that patient can cope up both emotionally, physically, mentally with all the aspects of this heart attack, and he can return to his daily routine. We generally advise not to lift heavy objects and to avoid strenuous activities. Coming back to the normal activity that patient can do, he can move around, he can walk, he can do gardening, but he has to avoid running at fast speed or doing lifting heavy objects. All these things can increase the chance of getting a second heart attack or patient developing heart failure. Again, patient should get his function evaluated again at the follow-up, and I think after the second advice, or I would say at the follow-up advice after he gets discharged, that is the most important thing when patient can begin his work routinely. The 30 days is the routine period where we tell patients of proper heart attack. If just patient has an electrical abnormality and he has gotten cardioversion or defibrillation done, we see for the causes, and if the causes are repairable, we repair them, and after repair a week's time, patient can do his routine activities.
All right. Well, thank you so much, doctors, for answering all our questions and making the viewers aware about the importance of learning CPR. Thank you so much for joining us. And thank you all for watching at home. Goodbye.